Hi, this is Kathy Jankowski, and I'm an associate professor at the University of Colorado College of Nursing. I'm an exercise physiologist and a fellow of the American College of Sports Medicine. And I'd like to talk to you today about exercise and physical activity for persons with metastatic colorectal cancer. So my objectives for today's session is to provide you with evidence so you can weigh the balance of the risks and benefits of exercise, to get some tips for exercise, including making a plan and self-monitoring your exercise, and to adapt exercise considering such factors as having an ostomy, experiencing neuropathy, or fatigue. So first, I want to set up a comparison of what exercise and physical activity are, because these terms are often used interchangeably. So I'm going to start with the broadest perspective on human movement, and that's really the change of any part of your body and any position of your body. So human movement is the big bucket that everything that we do falls into. And then we have physical activity within that, which is movement basically that is not at rest. So we're moving our entire body, we're not at rest. And within physical activity, we have something very specific called exercise. And exercise really refers to planned physical activity. And so what I'm going to do today is to help you come up with your plan that will help you to devise your exercise and what's appropriate for you. But know that physical activity and exercise are generally very important to your health and provide or impose very little risk. And we're going to talk about the risk and benefit of exercise for you. So, weighing the risks and benefits of exercise. Our overall goal is to minimize the risks and maximize the benefits. So if we start off with a balance scale for exercise of risk and benefit, what we want to do is get the best evidence we can, put it all together, minimize the risks, and maximize the benefits so that the scale will be weighed toward the benefit. So let's talk about the exercise risks and benefits for the adult with metastatic colorectal cancer. So some of the health benefits that we know for this population is to improve mobility, reduce fatigue, and improve sleep. Now, there are risks present for everyone who does exercise, but we want to manage those risks. And I'm going to show you and explain some ways you can do that. So some of the three most important ways are to start low and go slow. So if you're starting a new exercise program, or if you're even a good exerciser and you're starting a new kind of exercise, you want to start very modestly, very conservatively, and then progress along the way as your body adapts to that new exercise. Individualizing your plan of exercise will also help you to reduce the risks. And most importantly is self-monitoring. So you know yourself best. And I'm going to give you some tips for how you can monitor your experience of exercise and then make changes in your plan as needed. So first, some kinds of things that we want to consider when we look at the risk and benefit ratio. So first of all, what's really important is to seek a medical release for exercise from your care provider and to determine if there are any restrictions on the kinds of exercise you can do. So there's so many ways to exercise. Even if you have restrictions, you will still be able to do some forms of exercise at some level of intensity. So again, we're going to try to minimize the risks. We're going to consider such things as the cycles and severity of fatigue that you may be experiencing, side effects from treatments, including neuropathy, any complications surrounding the ostomy, or anemia or other blood conditions that may contribute to fatigue or bruising, whether you have bone metastases and where they are located, and then other comorbidities that you may be experiencing. So these are other health conditions that may or may not be related to the cancer at all, such as high blood pressure, diabetes, and obesity, and then any orthopedic limitations. So have you had a hip replacement or arthritis in your knees? Remember, we're talking about the whole person exercising, so we want to take your whole health history into consideration. But exercise is actually very beneficial for many of these conditions. But what we want in the end is to make a plan that you can follow and have a good exercise plan going forward. So let's talk about making an exercise plan. We want to talk about what types of exercise, how much, how hard you should exercise, and how often. So first, I want to give you some principles and a framework to help guide your exercise plan. And I'm going to start talking about 3 principles of exercise training. One is an acronym that we call FIT-VP, which I'm going to explain further in the next couple of slides, but basically answers the question, how much should I exercise, how long, and how hard? The next principle is specificity of training, which boils down to you get what you train for. So for example, weight training improves your muscle strength, but doesn't improve your aerobic fitness very much. Cardiovascular endurance exercise or aerobic training improves your wind or your aerobic capacity. And balance improves balance. Those are all good types of exercise and good training, and you're going to get specific benefits from each of those. They do have some carryover between them. They're not exclusive to one or the other, but they do tend to produce very specific changes in your capacity. And then self-monitoring, which I think is so very important, and I really want to harp on this to perhaps an extent that you will feel annoying in the end, but I think it's just so important for us as individuals to control our exercise, to know that what you are feeling is important, and it's important for you to monitor how you're feeling. So self-monitoring is learning what feels challenging about the exercise and why. So I'm going to give you some scenarios. So you might feel like today, exercise feels harder because I increased my walking pace. Okay, that's a normal reaction to increasing the exercise intensity. Or you may say, exercise feels easier today because I'm getting more fit. So maybe the exercise that was challenging to me 3 weeks ago is now feeling very comfortable. Or you may say, exercise feels harder today because I'm just feeling very fatigued, and that's understandable. Or you may say, exercise feels easier today because I cut back on my exercise about 10%. Maybe what I had set out as my goal turned out to be a little too ambitious, but when I backed it up a little bit, it felt very easy and doable. So those are all ways that you can frame how you're feeling about exercise and trying to come down to the explanation. Why am I feeling this way? So let's talk about the FIT-VP a little bit more. So this acronym stands for frequency, intensity, time, type, which is sometimes called mode, volume of exercise, and progression. And I've given you some further description and examples of each of those terms. So frequency of exercise typically is measured by the days per week or the sessions per day. Now, you may say, well, why would I have to exercise more than once a day? Once a day feels quite challenging in itself, and that's true. It's true for everyone, actually. I think every adult feels that way. But it may be that in your current condition that doing 5 minutes of exercise is where it's appropriate for you to start, but maybe you do 5 minutes of exercise twice a day for a few weeks, and then you move to 10 minutes one time a day. So you can have multiple short sessions of exercise per day. What about intensity? As an exercise physiologist, we usually want to quantify intensity as some percent of a maximum capacity. So maybe it's your maximum heart rate, or your maximum muscle strength. But as you, an individual, monitoring yourself, it may be more appropriate and more recognizable to talk about your perceived exertion, which asks the questions, how hard am I working? And I will give you some examples of how to do that. And then duration is usually in minutes. Mode of exercise can be aerobic or aerobic endurance exercise or resistance exercise, which we also call strength training. And then within each of those, you can have different types of activities. So walking or jogging, bike riding, using an elliptical trainer, those are all forms of aerobic or endurance exercise. Using resistance bands or free weights or machines or your body weight. You remember those calisthenics from gym class? Those are all forms of strength training. So volume of exercise is usually measured as minutes per week. And as I mentioned earlier, starting low and going slow is a good way to get volume in your exercise plan. So starting off low, maybe it's 10 minutes a day, 5 days a week. That's fine. And then progressing that at a very slow and planned manner. And then progression means to increase your exercise time first and then intensity as tolerated. So it's best to increase the amount of time that you spend in doing your walking, for example, before you increase the pace of your walking. And then this is measured over weeks or months or sometimes even years. So this is kind of a longer range way of planning your exercise. So let's look more at perceived exertion. So again, perceived exertion really answers the question, how hard am I working? How hard is my exercise intensity? And this is a scale called the Omni Scale of Perceived Exertion, and this is for aerobic endurance exercise. So what you can see is that the scale goes from 0, which is extremely easy, to 10, which is extremely hard. And so if we think about extremely easy, that would be, say, walking very slow on a flat surface. And then the exercise intensity progresses through easy, somewhat hard, and extremely hard. And so our exercise prescription is going to put us somewhere on this scale. We're going to be avoiding extremely hard, however, and keep you somewhere in the middle of this scale. Now, you can use the same type of scale for resistance training. So here's the Omni resistance exercise scale of perceived exertion. And again, it goes from 0, which is extremely easy, to 10, which is extremely hard. And we want to be working somewhere in the mid-range of this scale. So you can kind of put in your mind's eye a 0 to 10 scale when you're doing your own exercise and keep track of how hard you feel you are working. So when I looked in the literature, I wanted to find the very best information I could to share with you. And so there are not very many exercise studies in persons with metastatic cancer at all. And the best evidence I could find for you is a study of a home-based exercise plan. And this was called the REST trial. And like all good exercise studies, that's an acronym that stands for Rapid Easy Strength Training. And this study was involved in 8-week exercise plan in persons with stage 4 metastatic colorectal cancer or lung cancer. And about half of the participants in the study had metastatic colorectal cancer. On average, they were 65 years old. About half were male, about 45% were undergoing chemotherapy at the start of the study. And what I really want to emphasize to you is there were no adverse events in this study, which meant that nothing really bad happened to anyone in this study, to put it very plainly. So with that framework, I'm going to walk through what this exercise training was like. So we're going to apply the FIT principle. So there was aerobic and resistance exercise, And the frequency was to start at 2 days per week and then progressing to 4 days per week. So do you see how it started low and then went up, starting 2 days, going to 4 days? For the aerobic exercise, the intensity was considered moderate. They used brisk walking. And the way this was described was to walk 1 mile in 20 minutes. Now, a person may not start off being able to do that. They may need more time than 20 minutes to walk the mile, or they may not make it a mile, but that's okay. You would progress to that. And then for the resistance training, they did 5 upper body exercises and 5 lower body exercises on alternate days. So, for example, they may do their upper body exercises on Monday, and their lower body exercises on Tuesday or Wednesday, and then go back to the upper and then back to the lower. They did 10 to 15 repetitions per exercise. And I'm going to go through what some of these exercises were. But a repetition is being able to do the exercise once. So if you think about doing a bicep curl, doing one of those is 1 repetition. 10 to 15 repetitions means that fairly light weights were used. And to do 2 sets, so there'd be 2 sets of 10 bicep curls, or 2 sets of 10 squats. That's what we mean by sets and repetitions. In this particular study, the resistance came from using resistance bands. There's lots of types of resistance bands on the market today. So if we think about the aerobic activity, so the walking, is moderate intensity. So it's going to be in this range of somewhat easy to somewhat hard. And for starters, you're always going to start on the lighter side. So starting on the somewhat easy side. And if that feels okay to you and you feel okay the day after that exercise intensity, you could go up in your intensity towards somewhat hard. And if we look at the resistance training exercise, the same. You're going to be starting rather on the easy side. And if that feels okay, you can progress a little bit higher up the scale towards somewhat hard. And this might differ from one exercise to the other as well. Some exercises might feel more comfortable or easier for you to do than others. That's very natural. So what kind of exercises did they do with the resistance bands? So here I have I'm showing you the types of upper body exercises they did and the type of lower body exercises. On the far left column, I'm showing you the exercise advice that came from the previous slide. So that's just copied over to here. Well, let's look at the type of exercises that were included. So for the upper body, so on the upper body day, you would do a bicep curl on an upright row, a pull down type of exercise. So if you're familiar with resistance exercise, sometimes these are called lat pull downs. Anyway, it's an exercise where you would start with something over your head and pull it down, usually in front of your shoulders. A bat swing, which means a baseball bat, not a flying bat. So just swinging, and it's just kind of a rotational movement with some weight, and then a chest press. And then on the lower body, types of exercising, squats, which means standing with your, from a standing position, bending your knees and bringing your buttocks backwards. A calf raise, which means from a standing position, raising up on your toes. A straight leg kick forward, 1 leg at a time, please. Always keep 1 foot on the ground. A side leg kick to the side, and then a straight leg kick backwards. So in other words, if you're standing on both feet, you would kick 1 leg forward, then you could kick it to the side, then you could kick it backward. And all of these exercises can be done with body weight alone or with resistance bands. And for all of these exercises, and at the end of the exercise session, it's okay to feel that your muscles have been working, but you don't want to induce any pain. So if you're feeling pain, you should stop. And if any of these exercises are not appropriate for you, for example, if you have a bone metastasis in the arm, then doing the bicep curl or upright row may not be appropriate for you. And so you will need some advice from your healthcare providers on specific exercises that are best to avoid. So from that exercise plan, let's talk about some recommendations. If you have an ostomy, you can still exercise. It's still good for you, but just some things to be aware of. One is that you want to empty the bag before exercising. And then you want to take some extra training, weight training precautions. So as I said earlier, for all of us, you want to start with a low resistance in your weight training, in your weights. You want to progress slowly and use correct exercise form. You want to avoid breath holding when you're lifting the weight or doing that weight exercise to reduce intra-abdominal pressure. Now, this is actually true for everyone. No one should hold their breath when they're doing a weightlifting exercise. But if you have an ostomy, you do want to avoid that buildup of intra-abdominal pressure. Core exercises usually involve the abdominal muscles and the back. And you may need to modify them if you feel excessive intra-abdominal pressure or you see any unusual abdominal bulging. There's many, many ways to modify exercise. So certainly you can do other types of exercise. If you have an ileostomy, you want to make sure that you're maintaining hydration and know what your symptoms of dehydration are. Consider wearing an ostomy protector, shield, or belt. If there's any possibility that you might bump that area or come into contact. I don't know that you will be doing any contact sports, but you never know. Sometimes just walking the dog is a contact sport. And of course, you want to self-monitor. What kind of questions can you ask yourself as you're doing your exercise? Well, ask, am I holding my breath? And a way to avoid breath holding is to count your exercise repetitions out loud. So if you're doing your 10 to 15 repetitions of, let's say, the squat, you can just count out loud from 1 to 10 or 1 to 15, and that'll prevent you from holding your breath. Then, am I feeling excess pressure in my belly, or do I see any type of unusual bulging? If so, we want to either avoid that exercise, modify it, or reduce the resistance. Do I feel dehydrated? What are your symptoms? Typically, it's headache. Thirst may not be a very good indicator for you. Lightheadedness, weakness, those can all be signs of dehydration. So get some hydration going. And are you likely to sustain an impact near the ostomy area? And if so, take the necessary precautions to prevent an injury there. There is often fear of exercise in persons who have a stoma of any kind, but oftentimes abdominal exercises are recommended to strengthen that area and prevent a hernia. So perhaps you have been given some physical therapy exercises to prevent any risk of hernia there. And if you have any questions about safety or types of exercise, you might consider consulting with a physical therapist. Now, suppose you have peripheral neuropathy. There is unfortunately only weak evidence that exercise relieves the symptoms of peripheral neuropathy, but exercise appears to be safe. So you can still use your exercise for the other benefits, but it may not relieve your overall symptoms of peripheral neuropathy. Physical therapy is always a great start to do a balance assessment and to get some recommendations for different exercises to help improve your balance. If you have peripheral neuropathy in your hands, you may find that dumbbells that have a rubber coating on them are more comfortable for you to use. You might start with balance exercises for 10 minutes, and you can add this to that rest exercise plan that I went over with you earlier. So a balance exercise can be very simple. For example, you can alternate doing single foot stands. So start by standing on one foot for 10 seconds and then shift and stand on the other foot for 10 seconds. You can use a chair or a rail to provide balance if you feel unsteady. Another way to improve your balance is by using a semi-tandem stand. And you do this by starting with your feet side by side and then moving one foot forward so that on the forward foot, the heel of your forward foot is aligned with the midfoot, so about the arch on your opposite foot. And just stand like that and then switch feet. So you've got one foot that is halfway down the length of the other foot. And you can alternate that from side to side. And then there's the full tandem stand. And this is a greater balance challenge than the other two exercises. But in the tandem stand, you bring one foot fully in front of the other and you touch the heel of the front foot to the toes of the back foot. And so you can see it's like standing on a rail, but of course you're going to be on the floor, and you can use anything that you need to steady yourself, like a rail or a chair. And then of course you'll want to switch feet. So those are some examples of balance exercises that you can add to your exercise plan. And you can do balance exercises daily. And self-monitoring. How is my balance? Do I feel safe doing these exercises? Is my balance improving or is it getting worse? Do I need to perhaps get a reevaluation with physical therapy? Do I need to place my hands on a secure surface while I'm doing my balance exercises? That's okay. We don't want you to fall, but we do want you to challenge your balance so that it is there for you when you need it. Let's talk about exercising with bone metastases. It is possible. It's best to get medical clearance to exercise if you have bone metastases, because there will be certain types of exercises to avoid depending upon where the metastases are. Bone metastases do increase the risk of bone fracture, and that's why it's very important to have a physical therapy assessment and get some very specific exercise recommendations, both on what you can do and what you need to avoid. Balance exercises will continue to be important because you want to avoid a fall. Many resistance exercises can be modified to avoid putting excess strain on an area with a bone metastasis. For example, if you have bone metastasis in your spine, you would not want to do sit-ups or any type of forward movement where you're in a kind of a crunch position, because that might put a strain, excess strain on that lumbar vertebra. You might want to consider using a stationary bike to avoid falls. And again, use the self-monitoring. How is my balance today? Do I feel safe? Does an exercise cause pain? So we know metastases can be painful in themselves. If they don't generally cause you pain and you start an exercise and you feel pain, it is best to avoid that exercise. So to summarize, let's talk about, again, the exercise benefits and risks for you if you have metastatic colorectal cancer. We want to try to maximize the benefits and decrease the risks. So as a reminder, it's normal to feel mild and temporary muscle discomfort when you start an exercise plan or even start a new type of exercise. If you're already a good exerciser, just doing something new can cause some muscle discomfort. But anything that is lasting or a lasting pain or more severe pain is not acceptable and demands to be noticed and your exercise is modified. Always start low with your exercise intensity and go slow. You have plenty of time to progress to higher levels of exercise, but having a nice, slow, continuous ramp up is the best way to proceed. Except that you will have certain limitations. Everyone does. There may be certain exercises that you should not do. For example, if you have bone metastases, as we just discussed, or that you will have certain balance challenges so that you may have to use an exercise bike instead of a treadmill. Always use self-monitoring because you know you best. And how you react to exercise is very important for you to determine what's the next step in your plan. Make a plan and set small goals that lead to larger goals, and be flexible. And I recommend keeping an exercise diary to monitor your progress, because you'll be amazed at what great progress you will make. So that's what I have for you today. I hope this has been helpful, and that in the future I can talk to you about some of your questions and what you want to know more about in your exercise plans. So thank you very much.